Hello everyone, my name is Younes and I'm from Syria. I graduated from Faculty of Pharmacy at Tartous University and now I will talk about the role of nutrition on the treatment of COVID-19. So, the emergence of coronavirus disease was reported in Wuhan, China. The causative agent responsible for this disease was identified as a novel coronavirus known as SARS-CoV-2. Recognizing its global impact, the World Health Organization has classified COVID-19 as a pandemic, with a struggling number of about 100 million confirmed cases and 3 million deaths worldwide in March 2021. For the clinical presentation of COVID-19 typically included symptoms such as fever and dry cough. Um, in severe cases, there is an elevation in the levels of certain cytokines, such as interleukin 2, 7, and 10. In addition to TNF, this inflammatory cascade leading to cytokine storm appears to play an important role in the development of severe acute respiratory syndrome and multi-organs failure, underscoring the significance of the immune system in the processing of this disease. As I mentioned before, coronavirus causes a lot of symptoms such as fever and dry cough. In addition, some brain disorders and psychological symptoms such as depression, anxiety, and insomnia. Cardiovascular disease and kidney complications. The aim of the study is to talk about the role of nutrition on the treatment of COVID-19. So let's start to talk about vitamin D. So for vitamin D, a lot of studies showed that vitamin D reduce the inflammatory cytokines. As I talked before, that coronavirus caused a cytokine storm, and a lot of studies showed that taking vitamin D supplements will reduce the inflammatory cytokines in addition to improvement in T cell responses. And that will reduce the hospital stays for patients with COVID-19. For zinc, so let's talk about zinc. Zinc showed that a deficiency in zinc compromises the immune system, affecting the function of immune cells such as beta cells and T cells, and natural killer cells. In the context of COVID-19, infected children and adults have been found to have a lower serum zinc levels compared to non-infected individuals. And zinc play an helpful effect as an anti-inflammatory and antioxidant. And now let's talk about vitamin A. So vitamin A showed that play a really good role in treatment of COVID-19 because in vitamin A deficiency that will increase the type 1 inflammation and tissue damage and reducing the regulatory of immunity, in addition to reducing the IgA response and protective immunity. That's why taking vitamin A will be a benefit to patients with COVID-19. And now let's talk about omega-3 fatty acids. So studies showed that patients who got a low dietary of omega-3 fatty acids got an increasing in cytokine storm, and increasing in interleukin 6 and 8 and TNF alpha. So that will increase the cytokine storm and increase the cardiovascular damage. But people who eat a lot of nutrition that's got omega-3 fatty acids, that will reduce inflammatory action, and in addition to reducing that the cytokine storm and interleukin 1, 6 and 8. Now let's talk about water-soluble vitamins such as vitamin B12. Vitamin B12 play a good role as an anti-inflammatory and reduces the oxidative stress, because as we all know, COVID-19 causes oxidative stress and inflammation. That's why it causes lung infection. So vitamin B12 showed that to play a really good role in reducing the potential of the damage, and all the studies showed that patients who take vitamin B12 supplements will reduce inflammatory cytokine storm. For vitamin C play a good role as anti-inflammatory effect too, decrease the risk of developing cytokine storm. Antioxidant effect decreases oxidative stress, including lungs inflammation and injury, and decreases the duration of mechanical ventilation, shorten ICU stay, and decrease indirect antiviral effect. For magnesium play a good role. It's really important for vitamin D metabolism and activation, so taking magnesium with vitamin D will play a really good role in COVID-19 patients. So for alpha-lipoic acid, the ultimate antioxidant, the study showed that it play a really good role as anti-cancer and anti-metabolic disorder, and anti-aging, anti-COVID-19, anti-inflammatory, treatment of male and female fertility. And all the studies showed that taking alpha-lipoic acid play a really good role in COVID-19 patients. In this slide, I talked about selenium and copper and iron. For selenium, it play a really good role as a cofactor in the enzyme systems, and copper helps in synthesis of interleukin 2, in addition to robust immune system. For iron, SARS-CoV-2 needs iron for its replication, hence iron chelation might prove effective. And as we all know that other micronutrients such as vitamins play a really good role in COVID-19 pandemic, and it's really important to take micronutrients as supplements. It will benefit us in treatment. That's my presentation. Thanks a lot for listening, and hope you enjoy my presentation, and I'm happy to answer all your questions.